Our final speaker for this morning is Dr. Deborah Lightner. She is in our Department of Urology. She is an extremely busy woman and hard to get a hold of, and any time that we're able to have her come to clinical reviews, we are, very fortunate. And so we are glad that it worked out and everything aligned that she was able to come today, as she's been here a number of times in the past. So she's going to talk about managing refractory overactive bladder. Dr. Lightner, thank you for being here.
That was very nice of you. And the reason I can't come is I'm really busy in that Oval Office over there. We had at the AUA a backdrop of the presidential office a couple of years ago, and it was just really fun to sit there. That's all I'm going to say, other than the fact that you all must vote. I voted, okay? I don't have any conflicts with industry. What we're going to talk about very briefly are some of the definitions, the prevalence, and how you diagnose overactive bladder, how you evaluate and manage it, what the cure rates are, surprisingly, and to let you understand that refractory OAB is usually not what you think it is. First of all, what's OAB? It's a medical condition referring to urinary urgency with or without urgent continence. Men tend to be dry, women tend to be wet. It's usually associated with urinary frequency and nocturia, but it's in the absence of other pathological factors. These patients don't have bladder cancer. They have normal urines. They're not infected. And OAB means that the bladder is functioning outside of the norms of normal bladder function, and there's no habitual polydipsia, as we're going to talk about. And the other piece that oftentimes gets missed is that it's not secondary to a lack of cortical inhibition. You and I have bladders during this talk that are sitting there having low-level contractions all the time, and they never even rise to the level of consciousness because we unconsciously just suppress them. Lack of cortical inhibition can allow those low-level detrusor contractions to become much higher duration as well as power and cause overactive bladder. So what's the prevalence? This is the Box study. It was a beautifully done epidemiological study in Boston. And you can see that overactive bladder increases with age. So that by the time either men or women reach their 60s, about 20% of us are going to have overactive bladder. Now, the other thing that's interesting about overactive bladder is you can see a direct correlation with the CRP levels in patients who have an overactive bladder.